Jakarta, a bustling metropolis with already more than 11 million inhabitants. It's the largest city and also the capital of Indonesia. Its tall buildings, beaches, malls and monuments attract millions of tourists every year. Truly a city that never sleeps. While the city can offer a lot of opportunities, far from everyone lives a comfortable life. Garbage. Pollution. Overpopulated. Jakarta has become one of the fastest urbanizing cities in the world. People from rural areas move to the big city for a chance to earn a living. But now they're scattered throughout the city, living their lives with the bare minimum. With around 220 slum areas, with most of them in North Jakarta, slums can be found in almost any district in Jakarta, often located on unowned lands near rivers, railways and reservoirs, where trash can easily be collected to build temporary settlements. Kampung, which literally translates to village, has also become the term used to describe these slums and developing neighborhoods. What makes living in the slums so unfavorable for the inhabitants? And have there been any improvements? In the center of Jakarta lies Menteng, one of the most expensive districts in Jakarta. Many villas in this area are home to presidents and governors. But just across the river, tens of thousands of people live inside the kampung.
There are kind of lots of slum area actually in Menteng. We have a slum area where people around more than 5 households live in the same house. So it makes around 20 to 30 people lives in the same house in that slum area.
Untuk lingkungan sih sebenarnya di sini kurang bagus sih. Kalau saya mau dibilang tindas sebenarnya ada ya Kak. Satu, kita juga punya orang tua yang temurun-temurun dari sini gitu. Jadi ibaratnya untuk lingkungan kita udah nyaman di sini gitu. Terus untuk keluarga juga mayoritas kita keluarga di sini semua. Jadi untuk tinggal di luar kayaknya belum deh Kak. Tapi entahlah kalau misalnya kedepannya anak kalau udah besar ya kita kan nggak tahu. Tapi untuk kedepannya sih ada, untuk tinggal di luar ada, kan saat ini enggak. Karena pencarian kita juga di sini gitu loh. Anak sekolah, terus pencarian suami, saya juga dagang di sini, jadi kita di sini. Untuk saat ini kita nyamanin di sini gitu.
There's lots of kampung in Jakarta. Kampung is a very what should I call it? Very dense pack. Lots of people live in a very small area, which has a lot of challenge to improve their life because they doesn't want to move from there. It's already comfortable for them to live in there.
What once used to be a temporary settlement has turned into a permanent home for the people in the slums. While the exterior of the house has been upgraded over the years, the truth remains that the house and neighborhood are unsuitable for living. But after generations of living there, it's very hard to move an entire slum. Some even claim that they now own this once unoccupied land.
They own the house. They own the house. Funny, I don't even think I don't know why they could get the ownership of the house because the land itself is not suitable for housing. I think it's not according to the law for the people to have house that small, but they have the certificate for more than I have lived. I'm now 28 years old, but it's already been there. They have already had the certificate for a long time. So if you want to relocate them and say that you live illegally in here, they can show the certificate. So it's the problem the government have in here.
Improving the slums is a very important goal in the context of global health. To achieve the Sustainable Development Goals established in 2015, there needs to be action taken against poverty, hunger, unclean water, and the unsafe environment. The government has taken several measures against the growth of slums in Jakarta. The first one was the Kampung Improvement Program in 1969. This was the first slum upgrading program worldwide. It focused on sanitation, water, infrastructure, and health. Within the first 5 years, the lives of more than 1 million people improved drastically. The success of the KIP spread nation and worldwide, even gaining financial support from the World Bank. But despite the success, in the end the KIP had to be discontinued since it focused too much on external improvement. It was followed up by other programs that tried to change the lifestyles and land ownership within the compound. Sadly, some of these programs were short-lived, due to difficulties in implementation and high cost. Overall, the environment in the slums have improved drastically.
Kalau untuk perubahan ya, signifikan sih Kak sebenarnya. Kita dulu malah bilik Kak, bisa dibilang dari kayu. Jadi perubahannya bertahap, terus dari kayu, ada yang sekarang semi permanen kan, kayak separuh tembok, separuh kayu di atasnya.
The circumstances in the slums are unfavorable. People often get sick from bad hygiene. The scattered litter and bad housing makes it easy for parasites and vectors of infectious diseases to settle. Meanwhile, bad sanitation and unclean water can increase the risk of getting recurrent diarrhea and infectious diseases. So it's very important that the slums are provided with a good water supply.
Tapi dia masih kebanyakan 90%, hampir 100% kita masih pakai air tanah untuk mandi dan cucinya. Tapi kalau untuk minum rata-rata sudah pakai air kemasan, itu loh. Mandi cucinya masih menggunakan air tanah. Kayak saya juga masih pakai air tanah. Karena kebetulan ya memang dari Pak untuk daerah saya ini kebetulan air tanahnya masih lumayan bagus lah gitu loh. Malah ada beberapa yang masih air tanah itu dimasak, masih bisa diminum gitu loh. Nggak berbau, belum berbau lah gitu loh. Makanya dilihat, tapi kebanyakan sudah hampir ya 95% lah untuk minumnya itu mereka beli kemasan atau air isi ulang biar masak lagi gitu loh. Kalau yang mampu beli aqua gitu loh.
Lingkungan kita di sini sebenarnya kalau bisa dibilang kurang layak, iya. Tapi alhamdulillahnya warga di sini nggak punya penyakit yang terlalu berat gitu loh.
When someone does get sick, the first place in Indonesia to seek medical help is at the local puskesmas. The puskesmas is like a mini hospital and functions as the first line of healthcare. One usually visits the puskesmas when they're not feeling well for quick and simple care. For example, antibiotics can be given for infections and glucose can be measured for diabetes control. If the problem is too complex for the puskesmas, then the patient will be referred to a second-line healthcare clinic, usually the local hospital. The puskesmas is accessible for everyone, from rich to poor, but one may wonder, how can these people in poverty pay for their healthcare? Fortunately, the government does provide free healthcare for most slum inhabitants. In 2014, the Indonesian government started their national health insurance called the Jaminan Kesehatan Nasional in order to achieve universal health care. It covers more than 200 million people and is provided by a single public agency called BPJS Kesehatan.
We as a healthcare work together with an institution named BPJS, Badan Penyelenggara Jaminan Sosial. It was like Obamacare in US. So there's this institution called BPJS who has the money to pay for the insurance for the people, especially for the people who doesn't have any money to go to the healthcare. So we work together with them. We make sure people in the slum area who doesn't have enough money to pay insurance independently, or they doesn't have any money to pay out of pocket to the hospital, we cooperate with BPJS and we reach in people who doesn't have insurance. We make sure they are registered to the program, to the national program, so they will have insurance anytime they are sick.
Enggak, jadi kalau warga kami ada yang sakit, ada skema dari pemerintah daerah lewat puskesmas. Jadi dengan kartu BPJS itu kita begitu sewarga sakit harus bawa ke puskesmas, dan itu pun gratis. Kalau memang ada pemeriksaan lanjutan yang harus misalnya sakitnya kronis, kita dikasih rujukan ke rumah sakit besar karena keterbatasan ya kalau di puskesmas.
By law, people in poverty get their health insurance paid by the government. If someone doesn't legally fall under poverty, they still only pay 35,000 rupiah a month for premium, which is the equivalent of a little over $2. The first level of the JKN mainly provides non-specialist health services, like medication, consultations and basic treatments. Services like care from a specialist, medical rehabilitation and funeral services won't be provided.
Sakit saya utamanya diabetes mulai 2006. Terus menyusul mata, dari mata ke jantung ke saraf. 4 dokter kayaknya. Di rumah sakitnya gimana? Rumah sakitnya diantar sama anak mantu pakai motor. Pelayanan di rumah sakitnya juga baik. Ya, lingkungan udah cukup menjamin ya, 100% mah enggak, tapi menjamin lingkungan dari RW-nya, dari apanya, ada apa-apa langsung ada pemberitahuan. Ini waktunya kontrol ke RW tiap Rabu. Nanti kan balita, nanti lansia, ya beda. Ada dokter, cuma dokter ke puskesmas ke situ.
Still, many people in the slums don't visit the puskesmas. Health is not the priority for most of the people there. Going to these puskesmas may lead to problems for slum inhabitants. It's a big inconvenience, even if the healthcare is free. Because next to the healthcare bill, there are other costs.
So the burden of people who are sick is not only the healthcare bills. It's not only the hospital bills. When you are sick and you live in the slum area, mostly people paid per day. So as they work each day, they get paid regularly. So if they doesn't work in that day to go to the hospital, they doesn't get paid. That's the main problem, I think. So people are hesitant to find medical help, because if they doesn't go to work that day, then they doesn't get paid. If they doesn't get paid, they didn't have the money. If they doesn't have the money, then they can't buy food. They can't buy anything that they have to buy. So if we only account the hospital bill, then the BPJS can already pay for that. But the non-hospital bill, the money that they will lose if they doesn't go to work, that doesn't have that. We as a government doesn't cover that.
Gitu. Dan saya bilang, begitu kamu ke BPJS Kesehatan itu nggak usah takut. Sakit pun kamu nggak usah takut. Nggak usah takut kamu nggak punya duit, saya bilang. Kamu puskesmas saja dulu.
As a solution, the government of Indonesia has decided to move many healthcare centers into the slums, called mobile clinics. Mobile clinics have been implemented since 1983. The main purpose is to help as many people as possible with active case finding, done with easy, free and convenient care access.
Actually, mobile clinic is one of the program that was instructed by the Ministry of Health to reach in people who have difficult access to the public health center. So if the people have difficult access, we have to reach to them to give them the medical services they need.
Many people come to these posts for their health problems. A neighborhood in Menteng already has 213 people visiting it every month. It has been an improvement in areas lacking convenient health care, saving money and time for people who live further away from the puskesmas, while in other areas, the posts are not as efficient and effective in providing health care as planned. Because the mobile clinics became too accessible, the slum inhabitants rarely visit the puskesmas anymore.
I believe that people who lives in there, in RW 8 Menteng, not really have the problem of access to our public health center. It's only around 800 meters from they live to the nearest public health center.
The clinics were intended to provide quick healthcare checkups like hypertension control, but people are now using them as a real puskesmas. Many of the essential diagnostics can't be done in these clinics, while they're required to diagnose many diseases. Also, a lot of treatments can't be provided in these clinics as well.
Because things has changed. For 10 years, for 20 years, things has changed. So we should find out whether the people still need the moving clinic or not. Because if we still doing the moving clinic without proper estimation whether the people need or not, we are losing manpower to do other things that we have to do actually.
Mobile clinics weren't meant to be used as a full-fledged primary healthcare center. While the resources, like money and staff, should be focused on the puskesmas, a lot is ineffectively used by the mobile clinics. Thus resources are not utilized optimally and the care in the mobile clinic is limited compared to that of the puskesmas. Overall, there have been many improvements to slums over the years on different subjects: water supply, healthcare, education, lifestyle and infrastructure. But the living circumstances are still not ideal. No matter how much the exterior gets improved, the densely packed houses will remain the issue at heart. The longer the inhabitants live there, the harder it will be to relocate the massive communities within the slums.
There must be a solution for this. And we cannot tackle or handle this problem only from the health, public health sides.
Behind each implemented solution lies a new problem. So there's still a lot of issues that need to be addressed in the slums of Jakarta.